Hello and welcome. Let's talk about mastitis. So, what does it mean by mastitis? Inflammation of the breast is called mastitis. Classification of mastitis. It can be subareolar, intramammary or retromammary. Now, clinical features. Classical signs of acute inflammation like pain, tenderness, redness, swelling and rise of the temperature may be seen, and later abscess formation may be seen. Nipple retraction is also present. Treatment. During cellulitic stage, appropriate antibiotics like flucloxacillin or coamoxiclav can be given. Breast should be rested with feeding on the opposite side, and the infected breast should be emptied of milk by using breast pump. Support to the breast should be given, and local heat and analgesia should be given to relieve the pain. And if the infection does not resolve within 48 hours or abscess is formed, incision and drainage after being emptied of the milk. And newer method includes repeated aspirations under antibiotic cover can be done. Now, let's talk about acute bacterial mastitis. It is the inflammation of the breast due to bacteria, and the condition is known as bacterial mastitis. It is most commonly caused by Staphylococcus aureus. The clinical features are same as mastitis as discussed previously, and the treatment is also same as mastitis. End of the topic.